Tanisha. Remember the other day how we did that observation with you with the patient, and we were working specifically on building the relationship and rapport, and agenda setting and teach back.
Yes.
There was a lot to work on. What was it like being observed and with the patient interaction? How did that feel?
It was nerve-wracking, and a lot of it felt natural, like the interaction with the patient, but a lot of the tools that we're starting to learn and incorporate, that felt a little unnatural for me.
Yeah.
Specifically the agenda setting. And I feel like it's the two problems I have with it, well, I shouldn't say problems, but the two issues that I have are like polar opposites. Like, I feel bad telling the patient that I can only address some of the things that they want to address. Although I know it's necessary, I kind of feel like it's a privilege for them to tell me, you know, what they want or what they need from me. So for me to like cut it short, or for me to kind of dictate what is important, because I'm forcing them to choose. I feel like even so they may all be important, but I'm asking them to choose. And then the other part is asking, is there something else? Because the greater part of me doesn't want there to be anything else. So I feel like I'm like inviting them to say, is there something else? Is there something else?
Like they have to come up with something else.
Right. I feel like if it was important for them to say in the first place, like they would have said it.
Yeah.
But I do agree with the agenda setting and the tools, because it is helpful.
Yeah, I think what I'm hearing you saying is it's hard to find the combination between what you want to discuss, what's important to the patient, and how do we put those together and still make an efficient, productive visit.
Well said.
And it's hard. It's hard, especially with a young patient and this is really important stuff. And there's really important things on your side, and there's important things that she wants to get addressed. So it's a tough visit for sure.
Yeah.
So I want to say that I think that you did a great job with the relationship building. Something just really felt good about when you said, we were talking about college, and you said, I'm really proud of you. Like it just made me feel good. And I think if I were the patient, that would make me feel like you really cared. I think that was awesome.
Thank you.
I think it was really good. So, I know we just started this curriculum, and I know we're talking about the specific terms, and it's kind of clunky. I'm hearing you, if I'm hearing you right. I would suggest that we would do some more observations, not necessarily with video, but just so that I'm in the room watching what goes on with your patients, and maybe we could set a couple of things each time to work on, and then I can look out for those things. How would you feel about that?
I would love it.
Yeah.
Mm-hmm.
So maybe for the next observation, what kinds of things are the most important for you to work on first?
I would say still the agenda setting, because I feel like I do it sometimes and don't do it other times. I want to, become more comfortable with that. And then even the teach back, I feel I could work on.
I really loved how during the teach back you said, we've talked about a lot, and I just want to make sure that we're on the same page. I think that's so realistic it makes patients know that we're human and that we don't always remember everything, and we don't expect them to remember everything either. Because especially with all of that going on in a young person's life, it's a lot. You got to take a deep breath and decompress.
I agree.
So I think the agenda setting, I think if you break the skills down, maybe, and try working on one or two at a time rather than all of them in one visit, maybe they wouldn't seem so put together, so robotic.
That's a good suggestion.
Maybe we should try that.
Okay.
Just work on individual skills first, and then kind of put the whole piece together.
Sounds good.
Great. Let's do that.
Thank you.